Everybody. Arnot Wiley, Chief Operating Officer of Arnot Health. Want to thank all of you who have joined us for the review of our 2022 Patient Safety Culture Survey results. This is the second time we've presented this today. This morning at 7:30, we had about 50 participants, people that got in bright and early or stayed over past their night shift and listened to our results. So we're very excited. Heather Del Giorno, our System Director of Patient Safety and Risk Management, and Diego Carandini, our Vice President of Human Resources, are going to be really leading the bulk of this presentation. But I just wanted to kick it off. Thank you all for being here. The majority of my clinical background has been in the patient safety and healthcare quality space. And so I was very excited that within a few months of my arrival, we were able to conduct a patient safety culture survey. And so we're eager to share the results, and most notably for those of you on the line today who have been here since we conducted the last survey, which was in 2019, 2020, you're going to see how your excellent work has really helped us during a very difficult time with COVID further advance the safety culture and the safety and high quality care that we provide to our patients and the teamwork that we display every single day. But before we dig into the results, I just want to have some level setting and make sure that we all have a common understanding of why this is important. I don't have to tell any of you on this line, no matter what department you work in, healthcare is very complex. Errors and mishaps are known to occur, particularly when you're working with many, many different departments with patients that are all unique. However, as healthcare is looked at other industries whose work is also highly complex, highly error prone, and subject to catastrophic results when things go wrong, healthcare had a real opportunity to learn from industries like the nuclear regulatory industry, the airline industry, in particular, how air traffic controllers manage to keep thousands of planes in the air and avoid crashes. And also the naval carriers, being able to fly and land those planes is really incredible. And one of the things as healthcare started to look at those industries who are considered high reliability organizations, they looked at what commonalities they had. And one of the most important pillars of a high reliability organization is a culture of safety. And so we all have a common understanding what a culture of safety means. It means that an organization has a complete and total commitment to working collaboratively at all levels in a non-punitive manner to improve processes and outcomes that will be conducive to a safe, high quality care patient experience. It also is known within all of these industries and in healthcare that the tone for a culture of safety really is set definitely at the top. Our CEO, Jonathan Lawrence, and our board of trustees are required to provide a strong commitment to the tools, the resources, and the talent and support that we need for this extremely important work. Heather, we can go to the next slide, please. So our objectives for today, a couple of them we've already gone through. We've discussed why this is important. We will be discussing in very brief detail what the goals of this survey are. We're going to be, most importantly in my mind, reviewing how you all said we're doing in terms of our safety culture. Going to be looking back to the past, 2019, 2020, and compare the results that we have during this survey period to our previous results. We're also going to be reviewing comment themes. Over 600 of you took the time to answer an open-ended question and give us some suggestions on what one thing we could do to make Arnot Health a better place to work. We'll also be talking about some of the actions that either have already been in progress even before we launched the safety survey, and some of the work that we're currently engaged in. And then finally, Heather's going to be talking to you about next steps and what opportunities we have for all of you to continue to participate as we look to improve based on these results. Next slide, please. So as I've already touched upon, the importance of a culture of safety is that it establishes a tone that we acknowledge our high risk processes and the work that we do. We are committed to a non-punitive, blame-free environment where we want people to report errors and near misses, not feeling like they're going to be disciplined or reprimanded. Some organizations use the term just culture. And when an error occurs, you're looking at the system or the processes and not immediately looking to see who made that mistake. Because the evidence would tell you that behind every human error is some kind of a preceding error or opportunity within a system or process. It requires really extreme collaboration at all levels of the organization, no matter what your role, no matter what department you work in. And finally, as I've already touched upon, a true commitment to the resources and tools we need to address the highest safety concerns and mitigate harm. Slide, please. So the goals of this year's safety culture assessment were to identify where we need to improve, to make sure that we, as we're doing today, have an understanding, a common understanding of patient safety culture, of high reliability, of just culture. Also, really exciting for me was the opportunity to evaluate the effectiveness of patient safety interventions over time. And that's where comparing our previous survey to this year's survey. And I think you're going to be very proud of what you see. I was not here back in 2019 and 2020. So those of you who were, especially during, as I said already, a very taxing period of COVID, you should take great pride in the work that you've continued to do despite the environment that we're all in. We also have the opportunity to look at benchmarks or comparisons, not only internally, how we've done over time, but also externally. And the Press-Ganey organization was the company that assisted us with this survey. So we have the opportunity to compare our results to many, many other organizations, not only throughout the nation, but also many organizations worldwide are involved with Press-Ganey. And then finally, we get an opportunity to look at gaps between what we believe is the case in a safety culture and what actually people are seeing themselves or observing in behaviors that they are seeing in the organization. As administrators, we can't be everywhere. And so we have to do an excellent job of learning from you, listening to you, and improving based on what you tell us. And with that, I'm going to turn it over to Heather, who's going to take you through some key points in our safety presentation. Thank you, Heather, and thanks, everybody.
Thank you, Ronette. So we're going to jump right into the survey background. As many of you are aware, this survey was open from January 1st to January 31st of this year. And during that time period, now keep in mind this was a very short period of time to do a patient safety culture survey, we had 966 surveys submitted. To put that into perspective, when we last launched this survey in 2020, it was open for well over 2 months, and we had about 560 respondents. So we nearly doubled that in less than half the time. So that's really impressive and just speaks to the commitment of all of our employees and their willingness to take this survey and contribute to patient safety overall. We have the ability to drill down on basic demographic information. You can see that over here, the lower left-hand corner here. If you look at this data, you can notice how diverse the group of respondents is. This is important in terms of obtaining qualitative and really meaningful results. We have input from those from all over the organization, regardless of role, job duties, and position. Background on this survey. This survey was a little bit different than the surveys that we have traditionally done in the past. Prior to this year, we've used the AHRQ surveys on patient safety culture. This year, we used the Press-Ganey survey on patient safety culture. So the survey questions were grouped into broad categories, the first few being prevention and reporting, resources and teamwork, and pride and reputation. These are all very standard components of every patient safety culture survey. and also very important to understanding the culture of an organization. In addition, Press Ganey built in questions related to resilience and diversity. Resilience is new this year, but is so important to address as we come out of the pandemic. And then diversity as well. This is not typical of a safety culture survey, but it does acknowledge the individual strengths of each individual employee of the organization. As the more diverse, the more innovative and meaningful the work environment. So our survey results. As you can see here, this is very exciting. When we compared our results from 2022 to 2020, we improved in every area. So this is really impressive and really something to be proud of. The top 3 areas where we demonstrated the greatest improvement, number 1, I can report mistakes without fear of punishment. That's extremely important when we are looking at a just culture, making sure that we're focusing on the system or process that allowed an event to occur as opposed to the individuals who were involved. Next, very similar, focus is on the problem versus the person. And finally, communication between units is effective, also paramount to a safety culture. I'm just going to leave this up here for another few seconds so you can take a good look at it because this is very impressive. And of note, what you're looking at here is the percent of positive responses. So when asked these questions, this reflects how many respondents answered favorably to the question. Next, we have our key strengths. And this compares our strengths, our responses to national benchmarks, so areas where we're doing very well compared to other organizations throughout the nation. You can see the top 3. I'm not going to go through these all, but the top 3, I see every patient client as an individual person with specific needs. I care for all patients equally, even when it is difficult, and my work is meaningful. Again, something to be very proud of is this aligns with the Arnot Health values of excellence, integrity, compassion, and teamwork. In addition, if you go down the rest of the lines there, you can see that many of these strengths are related to the reporting of safety concerns, which again is essential to a high reliability organization where there is a preoccupation with failure. We want to know about our weaknesses, our problems, our safety concerns, because that is the only way that we can fix them. Next are our key opportunities. You can see here, again, I'm just going to highlight the top 3. The amount of job stress I feel is reasonable. My work unit is adequately staffed. And communication between physicians, nurses, and other medical professionals is good in this organization. Now, while these are our key opportunities, I think that this is something that is very common throughout the country at this time, especially as we are emerging from the pandemic. But it absolutely needs to be addressed, and it will be a major focus of our initiatives moving forward. In addition, Ronette had already touched upon the comment section. There were 648 free text comments. So that means 648 of our survey respondents took the time to contribute their ideas related to the culture and the safety of this organization and how we can improve upon it. You can see that there were overarching themes of leadership, communication, staffing, and compensation pay. So those were the most common areas that were commented upon. With that said, we also saw a number of sub-themes. So a comment would address 2 or more of these themes. I'm going to touch upon first some of the comments related to leadership and communication, as this was the most commented upon box. Again, I'm not going to read all of these, but you can see here, these are direct quotes that were pulled right from the survey, and these help better illustrate the themes mentioned earlier. So again, leadership and communication, that was the #1 most commented upon area. First and foremost, accountability, falling under that leadership bucket. Listening. Listening is also very important to communication and better means of communication within departments. What's really important and what I would like to highlight with the free text comments is that every single one of these was read. 648 was read by comments were read by our task force, because the comments shed light on why respondents responded the way they did, and that is very meaningful in that it can help us drive our initiatives. Next, there were also comments. The next most common theme was operations and clinical care. Again, I'm not going to read every single one of these, but the two I thought really shed light on some of the concerns were more focus on patients' individual needs. This is essential in delivering patient-centered care and treating our patients as individuals. And having better organized workflows and org charts. Again, really focusing on our systems processes and developing robust processes that have safeguards in place that prevent harm from reaching our patients. Next, I'm going to introduce Diego to take it from here, responding to the feedback that we received.
Thanks, Heather. So as a follow-up, as Heather mentioned and outlined, we saw in some of the earlier questions that there have been improvements already in some of these areas, and including the idea that we are taking measures to address safety. One of the things that we did here was we wanted to categorize for everybody the different areas where we already are responding and where we also have work planned to make future improvements. And we broke those out into several categories consistent with the themes around leadership communication, staffing, pay, clinical care, and recognition and appreciation. So the next chart will show you here that we have within those categories different initiatives focusing on retention of employees, which is an extremely challenging market for labor, and we need to have safe staffing levels, and retention is absolutely an important component of that. We have partnered with a lot of agencies and different strategies to make sure that we have reductions in vacancies in key areas. And where we haven't been able to staff to the needs and to deliver safe patient care, we will shut down certain parts of the organization to make sure that employees are at ratios where they can cover safely for our patient needs. We've launched a staffing committee for nursing, so that's going to gain momentum throughout the course of this year. And we have taken a lot of different strategies from a recruitment standpoint to open our channels as to how we recruit for talent in our labor market. The introduction of a staff recovery room, which is now expanding into other campuses as well, occurred a few months back. From a wage perspective, we have invested a very significant amount to make sure that we have competitive wages for our employees and for new recruits. We've also introduced and increased pay in areas such as on-call and certification and the referral bonus with which all our employees are eligible for. From a leadership perspective, there's been more rounding, and that is also expanding over time. More communication and really stronger, emphasis on making sure that we have communication from senior leadership, as well as plans to work with managers and make sure that they're trained in a variety of areas. The establishment of a workplace violence committee and the celebration of cultural diversity are also things that are underway and that you should be expecting to see more of if you haven't already. From a general communication standpoint, video programming, the use of Vocera in the emergency department, the launch of the Recognize platform, which you should be familiar with, an overall improvement in how we manage our policies, and the introduction of huddles in many departments are already some actions that are being taken and where we are seeing the opportunity to continue to improve. And then from a clinical care perspective, specific examples of efforts already in terms of managing patient falls, reducing those, making sure that we have sound approaches to pain management and to the use of restraints, making sure that we are able to mitigate hospital-acquired pressure-related injuries, that we are consistently administering plans of care that are effective, that we are managing conditions such as sepsis, and that we are making sure that we have advanced directives in protocols in place for our patients. So again, these are many of the initiatives that are either underway or are being developed and that will help us address the areas that have been raised throughout the survey. And with that, I will turn it back to Heather for our next steps. Can't hear you.
My apologies, I was on mute. Thank you, Diego. So Arnot has already convened a safety culture steering group that has met and is working with Press Ganey to further drill down on our data and identify opportunities related to our weaknesses, per se. With that said, we really need our employees and staff and front lines involved and engaged in helping us develop solutions and corrective action plans and risk mitigation strategies to improve the safety throughout the organization. So that's where everyone in this organization comes in. In a culture of safety, again, everyone is responsible for safety. We hold ourselves accountable to the highest standards of quality and safety, and we are actively looking for ways to improve the work that we do and our physical environment. So if you are interested in joining the Safety Culture Employee Advisory Council, you can contact me directly. There's been nothing scheduled at this point. We're working on collecting names and putting together the list. And at this point, I already have probably 20 individuals that have reached out that are interested in joining. So if you are interested, you can call me, email me, click me, pop in my office at any time, open door policy. And this is regardless of what shift you work. So this could be day, night, evening. We can come and talk to your departments. If you're interested in a further drill down of the data as it pertains to your area, let us know. We're more than willing to come to your area and provide that to you, so you can see how your department performed and perhaps take initiative in your own individual area as well. So with that said, I'm going to open this up to any questions. Because this is in webinar format, we don't have the opportunity to unmute you, but I'm going to look at the chat box. If anyone has questions, just pop them in there. Okay, so I'm not seeing anything come up, but that does not necessarily mean that there aren't questions. So again, if you do think of something, please feel free to reach out. This was a higher level overview of our performance, and again, we have the ability to drill down and are actively looking at the specifics of the results that we received. So please feel free to reach out, and we're more than happy to work with you. And if you can think of champions in your area, safety champions, send them my way, and it would be much appreciated. So thank you all for joining us today. I hope this was helpful, and I hope that it did reveal the results of our patient safety culture survey, because this is a very high initiative for the organization. So have a safe rest of your afternoon.
Thanks, Heather.
Oh, there is one in the chat. Oh, it's a thank you.
Thank
So thank you all.